If you've ever been told that your eyes are fine, but you still feel dizzy, tired, or can't focus, this might be the missing diagnosis. Let's talk about binocular vision dysfunction, or BVD. It's one of the most commonly missed causes of headaches, eye strain, and reading difficulty. Binocular vision dysfunction means that you're having difficulty having the two eyes that are supposed to work together as a team take information in properly and have that information combined in your brain so that you can then use that information to make decisions about how you're conducting yourself, depth perception, your balance, all of those sort of things. So, when you're using your visual system, your two eyes should point in the same direction as each other and then move together to send one clear image to the brain. Binocular vision dysfunction happens when that teamwork breaks down. So it's not usually blurry, it's not really a prescription problem, it's a coordination problem. So when people have binocular vision dysfunction, they often say, reading makes me tired, or I lose my place when I read, I skip words, I get headaches, pressure behind my eyes, I feel dizzy, off balance, car sick. They have difficulty with screens, and they can say that like they see clearly, but seeing feels hard. And sometimes it's hard to really express that appropriately to your eye doctor. And if it's an eye doctor that doesn't specialize in binocular vision, sometimes it's hard to treat as well. Standard eye exams are often going to miss this because they're looking at your 20/20 eyesight and making sure that your retina is healthy, which obviously is extremely important. But when we're looking to see how your visual system is functioning and how your eyes are working together, how you're taking in that information from your environment, we need a deeper dive. And so when your eyes are not working together properly, or sometimes they do and sometimes they don't, that can be very, very uncomfortable because that can make you feel tired. That can make you avoid near work. That can even affect your attention span. So we want to make sure that all of those things are being looked at. And the best place to have that looked at is with a behavioral, developmental, or neuro optometrist. Those are all kind of titles for the same person. And so when we're thinking about what that looks like for kids, we can have kiddos who have difficulty with their reading comprehension, avoidance of reading. For adults, we'll see that they have a lot of difficulty on screens, or they just feel like driving sometimes doesn't feel right. And it's these kind of vague descriptions that make it really, really hard to pin down as a patient and hard to pin down if that's not what you specialize in as a doctor. And so now, as a patient, you're better armed to be able to express what you're feeling so that then you can be more comfortable explaining that to your doctor and getting the treatment that you need. Oftentimes, like I said, glasses are not the answer because what we need to do is we actually need to treat how your brain is taking in your visual information. And that might sound like a tall order, but many doctors do vision therapy. And that's what you need if you have binocular vision dysfunction. Through vision therapy, you'll go through a course of exercises that are designed specifically to retrain how the brain is using the visual system so that then you can be much more comfortable. You'll have appropriate eye teaming, appropriate eye movement control, and you'll actually have some endurance of those skills as well. So find yourself a behavioral optometrist who will help diagnose it and then treat it so that you can be more comfortable.